Welcome to part 2 of Am I Actually Ovulating and Is This a Real Period? So in my last video, I was talking about people that think they're getting a period but may not actually be ovulating, and now I want to flip it and talk about the reverse. Can you ovulate and not actually get a period? The answer to this is also yes. If you ovulate and you get pregnant, you're not going to get a period usually, because progesterone is going to stay high because the implanted embryo is producing HCG and telling the ovary to keep making more progesterone. So it's going to stabilize the lining and continue to support the pregnancy, and you won't get a period. This is why we say after 1 week of missing your period, make sure you do a home pregnancy test. If you have a progestin IUD, the hormonal IUD like the Mirena, Kyleena, etc., you might ovulate. You probably are ovulating, but you're not going to often have bleeding because the IUD can prevent the lining from building up, so there's really nothing to shed. If you have scar tissue in your uterus, this is known as Asherman syndrome, your body may go through ovulations because this doesn't affect your ovarian function, but the lining can't build up and therefore shed properly. So this is why some people may be ovulating regularly and they have no idea because they have issues with their uterus and their lining. And then right after stopping long-term birth control, when people have been on it for years, or if they've been struggling with problems like hypothalamic amenorrhea, which essentially is kind of the same effect, your pituitary is not sending out signals, you haven't had many cycles of building up your lining, and so it may take time for your lining to get primed, so to speak, before your period returns to normal, but that doesn't mean you're not ovulating in the background. Here's where PCOS can add a little twist. Some people with PCOS can have irregular bleeding, sporadic bleeding from having just a thickened lining because it's not being shed continually. It's not being shed routinely and often enough. But if someone has what feels like a period lasting 4 to 7 days, and it's happening, maybe not regularly, but every 30 to 60 days, just as an example, the majority of cases, that is a true period that came from them sporadically ovulating. So don't just assume you're not ovulating because your cycles are irregular. There's a lot of bad information online. When I did a quick Google search on this, I was like, this is why I'm getting asked about this all the time. This is where this information is coming from. This fallacy that a lot of women with PCOS are having, ovulation with no period, or they're getting periods and they didn't actually ovulate. I would not go by that. I think that's way overblown. And what I'm telling you here is what I typically see in my day-to-day practice. But if you're unsure, track your symptoms, talk to your doctor. And if needed, we can get objective ways to test your ovulation with labs and ultrasounds to actually see what's going on.